everybody. My name is Stephanie Cinfio, and for my final project and my teaching, I did it on peritoneal dialysis. So what is peritoneal dialysis, or PD, which is what it's called for short? PD is a treatment for kidney failure, and it can be used as an alternative measure for people that can't handle hemodialysis, which is through the fistula on your arm. So my fiance's grandmother actually does PD, and I didn't know much about it until I had my first patient. I never thought I would actually even see it. So it's used for kidney failure, and it uses the lining of the patient's abdominal, which is the peritoneal, and a catheter actually goes in. And I really like this picture because you can clearly see where the catheter goes into and the peritoneal lining with the abdominal cavity. And as you can see, the fluid is hanging from above, which I just really like this picture because it helps explain it a lot, because the first time I saw this, I was super confused. How does PD work? So using a cleaning solution called dialysate, I'm probably pronouncing that wrong, it draws the waste and fluid from the patient's blood. So it flows from the bag, as we saw in the last picture, into the catheter connected to your abdomen. When the bag is empty, you disconnect that catheter at one of the ends, and you place the cap on the catheter so that fluid actually stays in for a little while. And this allows the patient to move around freely and do normal day-to-day activities. You can watch TV, you can walk around, anything like that. So I also like this because you see the transfer set, so you can disconnect it from like here. Ooh. And you can see where the permanent catheter, so right here, and you can disconnect it to these ends. So this is one of these tubes is where you drain the fluid from, and then this one is where you have the hanging bag that allows the fluid to go in. But after the dialysis is done, you empty that fluid back out, and that's into it. So you would clamp this one off, and you would put the unopen the other one, so allow it to flow into another bag. So there are two different types of PD. This one is continuous ambulatory PD. So for this one, it does not use a machine. The patient does the exchange by hand, which is what we did in the hospital, and which I was really confused about at first. It doesn't take that long, which I was actually really surprised about. It takes 30 to 40 minutes, and you keep that solution in your abdomen for 4 to 6 hours. And that can vary depending on doctor's orders. And you do this 4 times a day. And you can sleep with the solution in your abdomen at night, wake up, empty it in the morning. But one big thing is, though, before you put this solution into someone, make sure it is warm. There are special warmers to use to warm this fluid. You do not want to put cold solution into somebody. It can cause them to shiver and not feel well. The other PD is automated PD, and this is a machine does it for you. So instead of doing it by hand and needing to constantly change, you're hooked up to a machine called the cycler. It fills and empties the cavity 3 to 5 times a night. In the morning, you start with a fresh solution. So it really does the work for you. This, you're more hooked up to a machine, though, so that kind of limits your activities. Whereas the other one, you're more able to move around. So infection is huge. So you do have a catheter that is still hooked up to your abdomen. So we did it under sterile technique when I was touching the actual catheter going into the peritoneal. The rest can be done not under sterile procedure, but like emptying the fluid when you're done. You can just actually throw that down the drain. But infection is huge, especially for these people that are suffering and have PD. So the catheter site can tell you a lot. If you have pus, redness, swelling, bulging, or tenderness or pain, that's first sign of infection. But PD can also cause pain in the abdomen, fever, nausea, vomiting, redness or pain around your catheter, unusual color or cloudiness. If the catheter pushes out your body, that's obviously not good, and that's a worst case scenario. But the fluid can actually tell you a lot. If it's cloudy or a milky color, which has happened, I never got to see that, and I'm definitely glad that my patients, and when I have had patients with PD, that they have not had this happen, but I have heard stories, and that can be a huge sign of infection. And they will actually have you send down a sample of the solution that was taken and see if there's an infection that way. So my coworkers were super busy during this, and it's hard to explain unless you see it. I'm definitely a visual learner, and I know a lot of my coworkers were too. So I do have a video. For some reason, it is not playing, so I am just going to show you on here. And this is a great video. It really explains everything.
Your doctor may recommend dialysis, a procedure that removes waste products from your blood if your kidneys are not functioning properly. Healthy kidneys filter out waste, excess fluid, and electrolytes like potassium and sodium from the blood. These waste products exit the body through the urethra in the form of urine. If you have kidney disease, your kidneys gradually lose function, leading to an accumulation of harmful wastes and excess fluid in your body, increased blood pressure, and bone or blood problems. Dialysis can also be done to treat acute kidney failure, which occurs when your kidneys stop working suddenly, or to remove drugs or poisons from your body.
So
in one type of dialysis called hemodialysis, your doctor will use a...
I am going to skip through the hemodialysis part just because it doesn't pertain to my project, because this video is amazing, but it was just to show the differences.
Machine called... He or she will numb the area with local anesthesia. To construct an arteriovenous graft, your surgeon will make a small incision in your forearm and insert a soft plastic tube called a graft to connect an artery to a vein. To create an arteriovenous fistula, your surgeon will make a small incision in your skin and connect an artery with a vein. The doctor will use the membranes lining your abdomen, called the peritoneum, to clean your blood without removing it from your body. Before you begin peritoneal dialysis, you will have an operation to implant a soft tube called a catheter. Your surgeon will insert the catheter near your belly button, creating a port through which the dialysate will enter and leave your abdomen. Each peritoneal dialysis session is called an exchange. First, you will use your catheter to fill your abdomen with dialysate for a period of time determined by your doctor. Through the peritoneal membrane, waste products and extra fluid are continuously drawn out of your blood into the dialysate. Along with the waste materials it absorbed, the dialysate will drain out of your abdomen, into a disposable collection bag during your exchange.
And that is it, guys. The important thing is to remember is
Monday.com is a team management tool that changed.
Is that you really want to make sure that you weigh the dialysis bag before and you weigh it after, because if you don't have sufficient amount of, or like the same amount that you started with that you end with, that can cause a problem, and there could be a problem the body's absorbing it. There can be a lot of different issues with that, so it's really important to get weights before, weights after, of not only the bag but of your patient, and to really monitor them, because when they're sick with something else too, you never know what's going to go wrong. But I hope you guys really enjoyed that and you have a little bit of a better understanding of